like
Diagnosing without formal imagery. This is about testicular torsion. Again, EP Monthly, March 2021. Here we keep on talking about testicular torsion. I mean, it's a good article. I think more POCUS, more ultrasound, but I think this is another one.
They set this one up nicely because it's exactly the position lots of us have been in. It's like you're like,
I was just gonna say that all the time.
This clinically looks like a torsion.
Yep.
And my bedside ultrasound shows a torsion.
Yeah.
And I know that my consultant's going to want something formal,
right?
But that's not in the patient's best interest.
100%.
And so they kind of hold the keys of the castle. How do I approach it? So I think point of care ultrasound can do great good for our patients. I do think that the key is obviously we have to be very well trained in it.
Yes.
So that you build that trust in the specialist, like, yeah, okay, point of care, like no one's questioning your fast.
Yes.
And even if there's some nuance, that's okay. Like the surgeons get that because we've been doing it for so long. This is one of those things where I look at it's not rocket science. There is a skill to it. We do it well and build that trust. And then in the end, if we get it, then we can speed up the treatment of patients. And this article set that up very nicely.
I think it's nice. I actually shout out to I'm a design guy. The design of this article is nice too, with the 1 through 10 points. I would add that I trained at a time where you didn't do point of care ultrasound. I don't know if you were when we were at USC together. Were you doing it? I don't know. I wasn't. Yes. And this is much worse.
Yeah, I taught you
when you
most
don't
of your
have
point of care ultrasound. You were an attending, and I was a 1, I think. And
Did
you're
you?
like, so how do I? What's the probe? Well, this was linear. That was how.
You might be making fun of me, but that is completely within the realm of possibility.
I remember many a shift.
There's many times.
Make sure the gel is warm.
Even now, there's many times, even in the past, 5 years or so, if I put in a line, my muscle memory from gazillions of traumas is to do them without that ultrasound. And I still feel, I'm like, I'll hold it with this hand, put it between my legs like a phone. I suck. Bottom line is I suck. I shouldn't be allowed to see anybody.